Myself, Dr. Palaniraman, a practicing pediatrician from Tamil Nadu. Today's the topic for discussion is backache. Backache is a very common problem in practice. At any given point of time, around 60% of the adults suffer from backache. Traditionally, it was thought backache is uncommon in children. If it occurs, it is due to a sinister problem. But now, due to the change in the lifestyle and psychosocial pressure, back pain has been considerably increased in children too, particularly in the age group of 10 to 18, that is in the adolescent age group. But fortunately, most of the back pain are benign, and the duty of the clinician is to separate the majority of non-specific back pain from the minority of serious causes. The common causes of back pain are mechanical, followed by infective, inflammatory, degenerative, and developmental causes in case of pediatric age group, and neoplastic. Out of which, mechanical cause is the commonest cause with respect to back pain, secondary to altered posture, unusual activity, repeated minor trauma, and this backache, which is mostly non-specific musculoskeletal pain, can be managed with simple conservative measures alone, and it settles over a period of time very easily. Coming to the clinical approach of back pain, one has to rely on the clinical examination, mainly the history and physical examination, by which one can make around 80 to 95% of the diagnosis. To start with, the pain characteristics, the location of the pain, nature of the pain, severity of the pain, and radiation of the pain, and mainly the onset, duration, progression, as well as the aggravating factors and relieving factors and associated symptoms like fever and constitutional symptoms. Together, the analysis of all these factors will give rise to the anatomy, pathology, and etiology in majority of the cases. For example, whenever there is a diffuse back pain and mostly acute, the cause is mostly a mechanical cause, secondary to a trauma or a altered activity, and the pain is diffuse and not localized. It mainly points to the muscular origin or musculoskeletal and ligamental origin. Whereas localized muscle pain is usually due to the underlying vertebra or the disc or the ligaments. For example, the pain aggravated by forward bending indicates mostly the anterior vertebral elements are involved in the form of vertebra or disc. And in case of disc prolapse, the pain is mainly exaggerated by forward bending. In the same way, pain exacerbated by extension, it indicates the posterior spinal elements are involved. For example, the intervertebral joints and spinal facets and other ligaments are involved, like the conditions like spondylolysis and spondylolisthesis. The pain is aggravated by extension, abnormal extension. In the same way, radiating pain indicates it is a root pain, or also known as radiculopathy, indicates mainly the nerve roots are compressed. For example, in case of intervertebral disc prolapse with the nerve compression, the pain radiates to the back and as far as the leg as well as the toe too. Likewise, the timing of the back pain gives a lot of diagnosis. For example, early morning back pain after a night's sleep or back pain after inactivity mainly indicates an inflammatory pathology. Also, it is also known as gelling. That is, a stiffened joints after a period of inactivity is known as gelling. Mainly, it indicates inflammatory pathology in the form of ankylosing spondylitis or rheumatoid arthritis or reactive arthritis, etc. The back pain mainly not present in the mornings and mainly in the evenings, it indicates the mechanical causes in the form of whenever there is a postural problems like kyphosis, scoliosis, and the pain will be more in the night, pain will be more in the evening after a period of stress. As well as even degenerative causes, the pain will be more in the evenings. Whereas the nocturnal pain or nocturnal cries indicates always a serious problems in the form of infection or malignancy. So nocturnal pain should not be taken easily, it should be always taken seriously. And pain associated with the fever, it indicates mostly an infection. Pain associated with the constitutional symptoms indicates mostly a chronic infection or malignancy. Apart from the pain characteristics, one can approach the back pain with respect to duration. That is acute versus chronic backache. Acute backache indicates usually the duration less than 4 to 6 weeks duration. Usually the majority of time the cause is mechanical. For example, fall from a height or a unusual activity or unusual bending or lifting and producing a disc prolapse or a fracture, etc. Whereas a chronic back pain indicates mostly a pain more than 6 to 8 weeks duration. Mainly it indicates the infective, inflammatory, degenerative, developmental and neoplastic causes. To add to the history, the examination, and one should look upon the gait and the posture, mainly the kyphosis or a recent onset scoliosis, point tenderness or intervertebral tenderness, and straight leg testing in the form of sciatica stretch test, and any weakness or altered reflexes and the plantars and bowel bladder dysfunction. All these things will add to the diagnosis and narrow down the diagnosis along with the history. Most of the times, the diagnosis can be reached by the above clinical approach by history and examination alone. Once you reach a provisional diagnosis, clinical diagnosis, one has to look upon the specific imaging for confirming the diagnosis. For example, when you suspect infection or a malignancy, you should go for MRI. When you suspect degenerative changes in the form of spondylolysis or spondylolisthesis, one should go for a plain Xray or a CT scan. Like that, this should be the ideal approach. But without a proper history and clinical examination, if one ventures into the imaging directly, what happens is incidental findings and exotic diagnosis and unnecessary treatment and all will lead to treatment failure because that may not be the cause for the back pain. Coming to the management is simple once the diagnosis is made. As I have already told, majority of time it is a musculoskeletal, benign, non-specific back pain which can be relieved by local physiotherapy measures in the form of heat therapy and simple exercises and painkillers in the form of NSAIDs. By 4 to 6 weeks, majority of the pain will settle. But the minority of the patients which have serious pain with the red flags, which I am going to tell subsequently, they have to be referred for orthopedics for intervention like surgery. The duty of a physician is mainly to divide this majority from minority of sinister causes with red flags. What are they? Any age younger than 5 years, or a pain, a persistent, progressive, prolonged, radiating, nocturnal, and along with the constitutional symptoms and fever, and along with the weakness, bladder bowel dysfunction, all these are the red flags. One needs to immediately refer for a specific imaging immediately and for an orthopedics for a timely referral and timely management. So after the management, one comes to the prevention, which is the most important for with respect to backache. And nowadays, because of the IT profession and prolonged sitting, prolonged standing and abnormal postures, the backache is rampant. So one should mainly educate the parents and educate the patients mainly on the posture, the way he should stand, and prevent the prolonged sitting and prolonged standing, and how to lift the heavy objects, how to bend and how to lift and everything, all these things, and core strengthening exercise of the paraspinal muscles and abdominal muscles has to be taken care of, and thereby preventing the backache, which is the main thing which nowadays. And to add on this, because of the lifestyle and non-exposure to the sunlight, now the chronic backache and a chronic non-specific backache nowadays is mainly due to vitamin D deficiency, with the bone becoming osteopenic or osteomalacia is very common. So one has to mainly educate them mainly for the exposure to the sunlight and mainly the intake of vitamin D, which is also a preventable cause of backache nowadays. And so far I have clearly told about what is the prevalence of the backache, what are the commonest causes, and how one should approach, and how one should manage, and what are the red flags, and finally the preventive measures. Thank you one and all.